It is November 22nd, 2021, and here today with Gregg Gonsalves, who is at the Yale School of Public Health. And I'm going to turn it over to Gregg to tell you about what his life has been like throughout the pandemic. But hopefully, Gregg, if you could start a little bit with what were you doing in your career in late 2019?
Well, in 2019, after 30 years as an AIDS activist, I had been 2.5 years on the faculty of the Yale School of Public Health, working predominantly in the area and the intersection of HIV and infectious diseases and substance use. So on the other epidemic that's been happening while we've all been watching COVID pass over us, the opioid epidemic and HIV, HCV, other infections that are associated with intravenous drug use.
So you weren't busy at all, but I think but you were you were teaching, you were doing all this, and then what? I mean, maybe talk us through kind of when you started to get involved with the pandemic and how and what that's been like for you over the past, say, 23 months.
So I work in an infectious disease epidemiology department, which is there are lots of other epidemiology departments across the country, but not many that are focused specifically on infectious diseases. I also work and co-direct a project between the public health school and the law school called the Global Health Justice Partnership, which will the relevance of that will come apparent in a second. But in January, as soon as we started hearing about the pandemic or the outbreak in China, our instinct was to pull together our faculty who worked in China along with our postdocs who were incredibly worried about what was happening to talk about how we could help, right? It was totally focused on figuring out how we could be useful as a school of public health to the Chinese people, the Chinese government, and Chinese colleagues. Yale has very tight ties with many universities in the country. We did a town hall with people from the medical school and from the public health school early on, still with the idea that this was an epidemic somewhere else. But it quickly flipped in February, and we did another town hall where it became about what we were going to do now. And the town hall was actually done remotely. The first one was done all in person. We were also different components around the university were swinging into place. You know, early on, we did a letter signed by many epidemiologists, public health, legal scholars, and others about the human rights aspect of the pandemic. And this was based on an idea that this was something that we had seen before. We didn't really understand the scope of it yet. It was really, really early on. But it did outline some of the important things to think about that became apparent during the following months and over the next 2 years, was around the vulnerable populations that were going to be impacted by this pandemic, no matter what, because it always happens in infectious disease. And we put that out broadly and had 500 signatures and sent it to the White House. You may have even been on it, I can't remember. Meanwhile, we were trying to think about what we could do from a research perspective, and we partnered. We have a collaboration in our public health modeling unit with the Stanford Department of Health Policy and others over in Palo Alto, and friends up at Harvard, and started thinking about, is there anything we can do with public health modeling? And so we developed, like the many mathematical models that would be spawned by the pandemic. We developed a mathematical model which was tied to a queuing model to think about ICU bed capacity, but these started becoming a dime a dozen over the course of an epidemic. Modelers were in the act, and many of my friends here were advising the university writ large. People like David Paltilli were advising, all the Boston area universities and colleges, along with their own in-state experts. So all of this was swirling around. What happened is that I think for me, there was a little bit of a flashback to the old days of a pandemic that I grew up with, which was the AIDS epidemic, and a lot of the old gang reassembled. A lot of the people from the 80s and 90s reassembled, and this wasn't just the activists; it was the physicians like Rafael Sader at Columbia, Carlos Del Rio in Emory, and we all started thinking about how we were going to deal with the larger public policy issues facing us in the pandemic. Some of the earliest work was around what was happening in New York. I remember getting panicky phone calls from James Kronstein from Prep for All, because Health and Hospitals Corporation in New York City was fighting with the Department of Health about who was in charge, slowing down the progress of the initial shutdown in the city. There's a lot of anxiety and panic in those early days. And I remember writing a letter to Tony and to Debbie Burks and Robert Redfield and Alex Azar saying, please get it together. This is February or March, and we didn't really particularly understand what was happening in terms of the sort of car crash that was the previous administration's response to the pandemic. Really, like, where is the leadership happening on HIV and AIDS, on COVID-19 from the federal government? We were really, really panicked about it. And what was interesting is that my life took several paths during the past year and a half. One was going back to my activist roots and working with people, some straight up AIDS activists and health activists, but also researchers and clinicians around anything from battling back the Great Barrington Declaration and, Rochelle Walensky, Mark Lipsitch, me and Carlos wrote a piece of the Washington Post last October. I got asked to write a column in The Nation about sort of the developments in sort of Trump pandemic policy. So I was pulled in that direction and sort of being a public academic, but what's interesting is that many, many others were. I mean, there's dozens and dozens of people who were never sort of out in public like that about their with their work and about their contribution, and ended up co-authoring lots of stuff with my friend Julia Marcus about the intersections of Black Lives Matters protest in the pandemic a year and a half ago, with my friend Steph Baral on sort of how do you deal with the pandemic in the most humane way, even though we have to put restrictions into place. So that was going on. Started getting requests from lawyers saying my clients are locked up in this state's jail, this prison, this federal detention facility for immigration. And I must have written 24 affidavits trying to get people out of prisons and jails in various court cases from Massachusetts to Texas to Louisiana to California, et cetera. And so somebody would ask and I would do it. There was no question that it needed to be done. I think the other piece was that after probably 8 or so months, realized, there's a huge rush of people to do some of the modeling work around this. And I thought about, do I want to do something new, or do I want to go back and see if there's something within my own research that could be useful for this? And I'd been thinking about how do you hunt down undiagnosed cases of HIV, because 14% of Americans don't know their status. And so we took these algorithms we were developing for HIV infection and started working with some friends in Columbus, Ohio, about how do you find the needles in the haystack in undiagnosed SARS-CoV-2 infections in a community when you don't have enough testing resources to go around. So started doing that sort of academic work with colleagues at the Ohio State University as well. And then I think the next phase was as vaccines were starting to come online. There was initial work last fall, thinking about what the regulatory pathway was going to be for these vaccines. And there's a whole bunch of us here at Yale and other places have been working on sort of FDA policy for a while. And we're scared to death that the Trump administration was going to have an election surprise. So a lot of us were worried about that. But by the end of 2020, beginning of 2021, it was back to another sort of blast from the past, which was our fight for access to antiretrovirals in the global South. And so all the people who fought for antiretrovirals, 20 years ago, were back thinking about how do you ensure vaccine equity across the globe. And so, I've spent most of the policy work time I've been doing over the past year around this issue of vaccine equity. And, Gavin Yamey, who's a doc at Duke, and I were writing for BMC on this, tried to write some columns in The Nation for it. My friend Fatima Hassan from the Health Justice Initiative in South Africa and I did an opening plenary for the Conference on Retrovirus and Opportunistic Infections last year. Coming right out of that, we had 1,000 scientists sign on in support of vaccine efficacy, the TRIPS waiver, tech transfer, et cetera. It was amazing to watch because these are the people, we built connections and collaborations with and bonds with over 30 years. and everybody came out of the woodwork. It was just a different kind of setup than it was in the old days when, you know, scientists were sometimes at odds with activists, etc. It was much more of a meeting of the mind between advocates and scientists and clinicians who felt like they had a shared goal.
I mean, it's for me, it's just kind of fascinating to hear. I mean, I've been watching all the work that you've been doing, and to be able to wear both the advocacy hat as well as the academic hat, and to be able to leverage both of those roles has been really critical. I wonder what now? Like, I've been watching a lot of the work you've been doing in related to intellectual property rights and pressuring of pharmaceutical companies, and specifically around this equity issue. What do you think? What do you think is the next 6 months?
So it's hard to tell what's going to happen in the next 6 months, but my friend Amy Kuczynski, who's at the law school, and I are trying to write a book, and it's called The Politics of Care. And initially it was all about COVID. But then it's started to shift as we're trying to think about how to write this, about like the question of what happens next, and how did we get into this mess to begin with? And was it about a virus, or was it about a nation unprepared for what was going to befall it, no matter what it was, in terms of our weak public health system, our gross underfunding of public health, our fractured healthcare system, our sort of rudimentary safety net compared to other industrialized nation peers. So we've been trying to think about, like, between climate change and health disparities and all the things you might want to think of, how they're all linked together, and sort of the politics that our lives have been built around since, you know, I was in graduate from high school in '81. There's been sort of a withering of the state, and thinking about how do you get through another pandemic, and how could we have gotten through this one in a better way. And it really deals with some fundamental natures about how we politically organize ourselves. And so a lot of my thinking, you know, with Amy, and we're going to teach a course, you know, you said how to end an epidemic, we're teaching a course called The New Politics of Care this spring. And with our students, we're going to try to think through everything from the literature on social reproduction, on how we think of work and how we think of our economies, to sort of the history of white supremacy and its interrelation with infectious diseases across American history, et cetera, and try to sort of unpack and try to connect the dots to think of a way, is there a better way forward that's not just about pandemic preparedness in sort of its most explicit terms, but sort of national resilience that protects us from more than infectious diseases, but climate change, addresses some of the health disparities we've seen for decades and decades, et cetera.
Well, you'll have to let us know when it sounds like the book is still being formulated a little bit, and maybe informed by the teaching and your students. But when it is out, you'll have to let us know, and we'll link this conversation to the book.
Cool.
Gregg, I just want to thank you for everything that you've done. I've been so thankful, personally, professionally. I've been able to look to your work, and it's been from the modeling to the advocacy to bringing together, as you call it, the old gang, and reactivating some of the networks that were put in place over the last couple of decades. So thank you for everything that you've done throughout the course of the pandemic.